So welcome back. I'm Michael again, and what we have here is a right shoulder soreness and stiffness. And what we have done is evaluated which areas that we need to apply some acupuncture needles. And so what I want to do is show you exactly how I come about that process and what a treatment would look like if you came in to see me. So what we've done is we've done a number of stretches, and what we have found is that this area of the arm has the most pain and restriction in the range of motion. So we're going to apply a couple needles here. What I want you to do is have you stand up, and I'm just going to reenact the diagnosis that we came up with. We found that with moving the right arm back, that showed the most restriction in the range of motion. What I also found out, go ahead and relax, is that when I placed my finger on the correct acupuncture point, which is right here, and then I repeated the stretch, go ahead, we have found that there was a decrease in pain and an increase in your range of motion. So I use a very different type of a needle. This is a needle that will actually just rest on top of the skin. The needle itself is 0.3 millimeters long. You're not going to feel this needle. The only thing is you're going to see what looks like a Band-Aid. The needle will stay on anywhere from a few hours to a couple days. Okay, so ready for your first needle?
Absolutely.
Okay. Slightly hidden. We have a little camouflage. Okay, now I want you to repeat that stretch and see how that feels. Still a little bit tight?
A little bit, and then
Okay.
spur my shoulder.
Alright, so let me try one more point here. Go ahead and try that. Repeat the stretch. A little easier?
Mm-hmm.
Okay. So what we're going to do is we're going to use a traditional acupuncture needle, and just so that you can see the difference between the two needles, they both are very effective. One just has a different reason why you would use that. What I've found is that this part of his forearm has a very stiff muscle, and what I'm going to attempt to do is to go into the muscle belly itself, release the muscle so that it relaxes, and he'll have some additional blood flow, a better range of motion, and a less stiff and sore arm. Okay, go ahead and sit down for this part.
Okay.
Normally what I would do is I would have the patient lay down and maybe apply a couple different needles, but just for the short term here, what I'm doing is just going to show you what a traditional acupuncture needle looks like. Each needle comes in its own sterile package. They are all one use, and they are thrown in a sharps container as soon as they're removed from the skin. So what we do is we find this sore area again, and sometimes what I might have to do is just insert the needle slightly more. And now the needle will rest for 20 minutes along with the patient. After 20 minutes, we remove the needle and you're allowed to go home.